This is Anam Raza from Ameri Prime Hospice, and here we are today presenting you a live webinar to clear some misconceptions people have about hospice care. Here with me today is Amada Flores. She is our company's chaplain, and we will be clarifying a lot of questions people and loved ones have towards their patients that are passing away. What is hospice care? People generally ask. Hospice includes medical care with an emphasis on pain management and symptom relief. Hospice team of professionals and volunteers also address the emotional, social, and spiritual needs of the patient and the whole family. Overseeing all the care, palliative care, and hospice medical director who may also serve as the attending physician. Alternatively, the patient's own physician may continue in this role in coordination with the hospice team and its plan of care. For the following minutes, we will be speaking to Amada, who deals with the patients one-on-one and answer most of the questioning that takes place during hospice care. Amada, how do you feel working for hospice?
I think it's a unique time in the life of any patient, and I feel very blessed to be at that particular time in their lives.
And how does your family feel about you working towards hospice and dealing with these patients on a day-to-day basis?
I think they feel very relaxed. They feel this is a time when they need someone to walk them through the process of grieving, and there's a lot of confusion about how they should feel. Is it normal? Is all this conflict normal? Because there's all kinds of things happening. So this is a time when the chaplain can reassure them of that the grieving process is in fact what they're experiencing, and then provide some resources and help as well.
Does hospice care really mean that somebody that's passing away is finally giving up?
No, it really means that we provide care with dignity to the patient, and that they're probably being told that nothing else can be done. But we never know when the day is going to come, so we just provide services while they are in the process of dying.
Another misconception a lot of people with hospice have is that do people that are diagnosed with cancer, are they only qualified to be a part of hospice care?
No, hospice actually cares for many more time limiting illnesses that people can die throughout time. But it could be heart, it could be kidney diseases, lung, COPD, any other illnesses that people can have that they are for a long periods of time, and they would not recuperate from them.
Another misconception people have that is in reference to hospice is that people come to us when they're about to die. Can you clarify that, Amada? Is it that people are passing away? That's when we kick in?
Well, while most of the patients do come with terminal diagnosis, not all of them, although most of them will die, not all of them do. However, the emphasis is on the care for the family and the patient while the process of being cared for during that time.
So hospice care isn't initially when you're passing away. We provide you comfort, care, and dignity in your own homes, surrounded by your loved ones. So that is another misconception a lot of people get afraid of when they hear hospice care. Another question that we come across as part of hospice is that once somebody is associated with hospice care, will they be dying promptly or very speedily?
Well, it does not accelerate the process of death, and it does not prolong life as well. It improves the quality of life while they have it, and obviously no one knows the end, but it does help in the process.
A lot of loved ones and the patients that we deal with want to know, will they be able to keep their physician that they're currently dealing with?
Yes, your physician will be involved in your care.
Hospice is a very touchy subject for loved ones and people that are accommodating care for their loved ones. So a lot of people come to us with the same question, that who will advise for them to start hospice care? How would you go about that, Amada? How do people approach hospice care? How do we get involved with something so touchy as passing away of a parent or a loved one?
Well, you are correct. I think it's very difficult for family members to bring it up. So sometimes it is better that a doctor initiates the discussion. That usually happens in a hospital setting, but it can also happen with your private physician, that you can discuss it with them, and they discuss it with the family. So it's not the family directly who would do that.
With AmeriPrime Hospice, we also ensure that people are taken care of at their own convenience, at their own free will. And a lot of questions that we do come across are sometimes that are patients obligated to stay with hospice care?
No, the patient has a choice to either stay or leave. Sometimes they do get better and they do get discharged because they do have to meet eligibility. So it is up to the family and the patient.
When patients come to us, they are mainly provided with a terminal diagnosis, and a lot of people have questions that apart from their terminal diagnosis, the diagnosis they are provided with their physician, are we able to treat those as well, Amada?
Well, as long as it improves the quality of life, but it does not prolong life, because when patients come to hospice, they are in the program because they have a terminal illness.
Is it necessary to have a DNR present for hospice care?
It is a requirement to have it. Sometimes we have patients that are not ready and the family's not ready to sign the document. We understand this is a difficult time. But however, the hope is that that document will be in file eventually through the process.
To be eligible for hospice care, a lot of family members and loved ones want to know that do they have to be at a final stage of dying to be part of hospice care?
As long as the doctor determines that the patient is at that point in their lives, then they can be referred. In the time limit, there's no time limit actually. As long as the patient needs the care of hospice, then they will be receiving it.
A lot of loved ones want to know that for being eligible for hospice care, does the person or the patient, their loved one, have to be at final stages of passing away?
That has to be determined by the physician. And once they make the referral, then we provide care as long as the patient needs it.
Another common question that hospice care providers do come across is that although this is a very touchy subject of somebody passing away, a loved one especially, they want to know how expensive is it to be a part of hospice care?
If the patient has Medicare, mostly would be covered. And for those who cannot qualify for Medicare for whatever reason, then they can apply with HMOs and insurance, their own insurance policies.
As part of hospice care, it is something that comes into play when families are overwhelmed with the situation on hand that somebody that they have been so close to is going to pass away. Are we always a part of their family to provide care for them, or is it that the family is not able to take intake and the care?
The staff would assist, provide training, encourage the family to take care of the patient. We have nurses, we have nurses aide that will come and assist as well. And we provide the services 24 hours a day, 7 days a week for the family.
So hospice care pretty much takes initiative and assists with loved ones to make sure that the passing away is a very smooth process and we are there with you throughout. Is hospice care generally provided for the elderly that are passing away?
No, hospice care is usually provided to anyone who has a life-limiting illness, regardless of age.
Once a patient passes away, does hospice care initially end?
No, it doesn't. We provide bereavement services and grief support for 1 year after the death of the patient.
As death being a part of life that everyone has to come across, a lot of people are not mentally prepared to deal with that. How does that work, Amada? How do they accept their death? How does that go about?
It is a very difficult process, and we assist the families in the process of coming to terms with what it means to face death. It is a struggle. The patient struggles with that, the family struggles with that, but we are here to help the patient walk them through that process so they can come to terms and embrace the welcoming of what's coming next. And we work as a team, the nurses and the chaplains and everyone involved, the social workers. We work as a team to ensure that it's something they accept. It's something they embrace at the end, and people can make peace with that point of their life.
So it pretty much depends on them to take it at their own span of time to deal with the process of death.
Absolutely. We do not pressure them. We just walk with them through the process.
As part of hospice care, we have a lot of duties divided to assure that the comfort and care is provided. Amada Flores being part of the chaplain services. Amada, you deal with the patients one-on-one who are passing away. There's a grieving time and you meet the loved ones. How do you go about that on a day-to-day basis to make sure that it's a transitional phase for them and a comfortable one too?
We are very open about what's happening with them. We are gentle in the process at the same time. We disclose what we know is happening. We help them to process their feelings, to make peace with those around them. It's a time that patient might just want to sit down and talk with us and just have a conversation. Sometimes they really want us to spend a lot of time with devotionals, reading scripture according to the tradition. So we do spend time on a one-to-one basis. Whatever the patient needs, then that we provide. Whether it is just to say, look, I need to make peace with my sister or my brother or my son, then we help them with that. If it is just someone who just needs prayer, then we do that as well. So whatever the need is, we make an assessment and then we proceed to fulfill that.
As part of chaplain services, do you also assist with the loved ones that are there apart from the patient?
Yes, very much. We help the caregivers. Sometimes the caregivers need a lot of assistance because there's usually conflict that comes as a result of the pain being experienced. So we do deal with that as well. We comfort the family. We help the patient understand where they're at. So it's a combination of things, but we deal with all those issues.
As part of hospice care, we have a lot of duties divided to assure that the comfort and care is provided. Amada Flores being part of the chaplain services. Amada, you deal with the patients one-on-one who are passing away. There's a grieving time and you meet the loved ones. How do you go about that on a day-to-day basis to make sure that it's a transitional phase for them and a comfortable one too?
We are very open about what's happening with them. We are gentle in the process at the same time. We disclose what we know is happening. We help them to process their feelings, to make peace with those around them. It's a time that patient might just want to sit down and talk with us and just have a conversation. Sometimes they really want us to spend a lot of time with devotionals, reading scripture according to the tradition. So we do spend time on a one-to-one basis. Whatever the patient needs, then that we provide. Whether it is just to say, look, I need to make peace with my sister or my brother or my son, then we help them with that. If it is just someone who just needs prayer, then we do that as well. So whatever the need is, we make an assessment and then we proceed to fulfill that.
As part of chaplain services, do you also assist with the loved ones that are there apart from the patient?
Yes, very much. We help the caregivers. Sometimes the caregivers need a lot of assistance because there's usually conflict that comes as a result of the pain being experienced. So we do deal with that as well. We comfort the family. We help the patient understand where they're at. So it's a combination of things, but we deal with all those issues.
These were some commonly questions that come about for a hospice care provider, and we hope that you were able to watch us and have some of those concerns clarified for you. Thank you, Amada, for being part of Mary Prime Hospice, and we look forward to serving you and your patients.
Yes.